Hello, viewer. Welcome to Health Talk. I'll quote Mae West. He said, "You only live once. And if you live it right, once is enough." Today's Health Talk, I have an amazing guest. Welcome.
Thank you. Thank you for having me here, Ben Bella. My name is Michael Dunga. I'm a clinical oncologist, and I'm here to brief you on the topic of the day.
Welcome, Mike.
Thank you.
In today's topic, we're going to talk about breast cancer. We know that cancer is a disease that has ravaged or caused panic amongst us globally, not only here in the country, but globally. But today with my guest, we're going to demystify it. We're going to look into various things that he's going to share with us. Our social media handles are GBS TV Africa, our SMS line 21144. Welcome, Mike.
Thank you.
We're talking about breast cancer.
Yes.
I think maybe we can start by talking about what is a breast.
Yeah, a breast is basically it's a glandular organ that is located in the chest, that is composed of connective tissues, fat, and some breast tissue that have glands that produce milk. It's also known as mammary gland.
Mammary gland.
Yes.
Oh, thank you. So also men do have breasts?
Men do have breasts.
Yes.
But I'm sure most of them, they don't recognize they have breasts, but you have breasts.
Also, we have breasts.
Yes.
Thank you.
But the two aspects of a breast is that functional aspect, which has adipose tissue, the glandular part, and there's a aspect that has the anatomical, the shape and the size. So as men mostly have the shape and the size, but the women have glandular and the adipose tissue that make it a bit enlarged.
Thank you, Mark, for that
Yes.
elaboration. Now, when you talk about breast cancer,
Yes.
so that my viewer can understand
Yes.
in a simple language,
Yes.
what is breast cancer? And is it possible it affects both gender or it is just one-sided? What is breast cancer?
Thank you, Ben. Breast cancer is, these are cancers that affect the cells of the breast, that affect both female and male. And it affects depending on it has different kind of breast cancer because depending on the type of cell that affects. There's that affect the glandular part, the connective tissue, and the ductal part. So both male and female are affected, yes, but 99% of the population is female and 1% accounts for male.
1%, that's a global.
Global, yes.
So even men get breast cancer?
Men get breast cancer, yes.
So in short, when you continue to talk about it, you would advise that also men go for screening?
For screening, yes.
Because I believe most of our men outside there, they don't do it. They assume maybe these are female.
And that is a common phenomenon because they assume it is a female problem. But male even get affected. 1% can be you.
Okay.
Yeah.
Thank you, Mike, for that elaboration
Yes.
and clarification. Now, let's talk about how does it come about, breast cancer? Or what is the cause of breast cancer? Or we can talk about the risk factors that can lead somebody to getting breast cancer.
Definitive cause of the breast cancer is not known yet. But we are working with predisposing factors, which are called risk factors. And in breast cancer, they are actually divided into three. There are those that you can modify, you can change a bit, and those you cannot do anything about them. And those are the other ones who are environmental factors. So we'll start with non-modifiable factors. You can't do anything about them. One can be age. Mostly 55 to 64 years are affected. But current research has shown 20 to 50 years are dying of breast cancer. We talk of race, ethnicity. These are white are more affected than they're blacks. We're talking of things like personal family history can also be predisposed to cancer. We're talking of menstrual history. If you say menstrual history, depending, when did you start your menarche? Did you start below 12 years or after 12 years? Below 12 years can also be a risk factors. We're talking about when we're talking about radiation. These are things we're working every day, the sunlight being affected. Then we're talking about genetic factors, can be blood-related factors, and then things like menstrual, not menstrual, but menopausal factors. those ladies who get menopause after 55 years, they are more exposed to estrogen for long. So most likely they also can get affected by breast cancers. Then there are those things that you can work on yourself. Things like obesity can also predispose you. Exercise, if you don't exercise, just sitting there, sedimentary life can also expose you to breast cancers. These are controlled pills. These are birth pills, hormonal replacement therapies, alcohol use, and even breastfeeding. It's believed that those who breastfeed for long, they kind of reduce the chance of getting breast cancers. And then things like not having a child, especially when you have null parity, they are more predisposed to breast cancer than those who have kids. Then we have the environmental factors. These include things like exposure to carcinogens, chemicals, electromagnetic fields, radiations, and even alcohol use. Those are some of the risk factors that can predispose you to breast cancer.
Wow,
Yeah.
that's so elaborative, Mike.
Yeah.
Now, you talked about those ladies who breastfeed for long.
Yes.
They have a lower risk. Now, what do you tell our girls outside there who don't want to who refuse to breastfeed for long, fearing about their body image, that their breast maybe will, they talk about the fallen soldiers.
Yes.
So what do you advise them?
Yeah, it's a common topic ladies always ask about their sagging breasts. They fear that. But I think it is better to prevent than to be sorry. So I'll advise them it's better to breastfeed for long, because you rather reduce the chance of breast cancer than maintaining your status quo of probably the breast being at a level of a teenager and then later on suffer breast cancer. So I'll advise them to breastfeed as required by your medical physician who has advised you.
Wow.
Yeah.
Thank you, Mike, for that. Now, you talked about carcinogens.
Yes.
Can you break it down to my viewer so that he understands the carcinogens? What are these carcinogens? Because you talked about exposure to carcinogens. What are carcinogens in a lay person so that they can understand?
Carcinogens, they are basically a substance that exposes you to cancer. And these are some of the things that probably it's unwanted for your body functional. This can be things like chemicals, things like asbestos, being exposed to asbestos. Those are things from the tiles. Even radiation is a carcinogen. Fumes from the vehicles, fumes from the fuel, those are
Tobacco.
Yes, those are some of the things that can categorize as carcinogens. They can actually precipitate you to getting cancer, because normally what they do, they damage the cells, either in the breast. Not normally, the carcinogens are not basically on the breast alone. They can affect any cell of a part of the body. So the cell that get affected is where it causes mutation, and cancer can develop from there. So it's just good to be cautious about your environment.
Okay.
Yeah.
Thank you so much, Mike, for that elaborative and clarification. Now, this breast cancer,
Yes.
are there signs? Is there something that my viewers out there maybe can be, as you are maybe addressing him or her, can be at the lookout? Are there clinical features for breast cancer? What are some of the clinical features?
Yeah, there are clinical features for breast cancer, though I think 1% can be asymptomatic. Asymptomatic by means it doesn't show any sign. You just go to a hospital, you get diagnosed, and like, you have breast cancer, but you did not observe anything. But 99% of the breast cancer, they have clinical features. I agree with you.
99?
99%.
Okay.
So things like you need to be on lookout. There are things like lump. It's a common, I'm sure most of my viewers have heard of a lump in the breast. Lump in the breast is you palpate something in the breast, which is normally, if you normally palpate, you don't feel it, but this for the first time, you feel something in your breast. You're like, hey, what is this? You need to seek medical advice. There's another sign, there's a blood discharge or abnormal discharge from your breast. Can also be an indicative of something that's coming up that you need to seek medical advice. Another thing that you need to check out for, their dimpling. You find a part of your breast is not same. You have this shape of a breast that you know yourself well when you look in a mirror. But the texture and the shape of it, there's dimpling, there's somewhere that is, By dimpling, I mean there's a press, you find there's a bit of a kind of
It's a depression.
depression on your breast. You also need to seek medical advice. There's also things like pain. It's not an indicative of a breast cancer, but you just need to get advice from the clinical perspective. What could be the cause of this pain in your breast? You also inverted nipples. Those are some of the things. Nipple, you're going inside. You're like, and my nipple never behave like this. They also look at the things like if you palpate your axillary, you feel like there are nodes. You're feeling kuna uvimbe fulani kwa makwapa yako. You also need to look out for medical advice. Then there's some skin redness around your breast. Then there are those late signs that probably you ignored or you did not notice the other signs. There are things like laceration around your breast, your nipple, ngozi inatoka around your breast. There are those, I think, when you're showering, when you're washing your axillary part, your makwapa, you feel there's a node. There's supraclavicular nodes around your chest. And then there's also things like pain in your shoulders, in your hip, in your pelvis. You feel pain in the bones. Those are some of the signs that probably there's something wrong with my breast.
Wow.
Yeah.
So those signs are
those
so
are
many.
late signs, yes.
There are so many signs.
There are so many signs of breast that you can, if you miss one, you can detect the other ones for you to seek clinical advice.
So in short, our viewers are there. If there's any change
If
to our
there's
breast
anything
besides
yeah, exactly, from the normal breast.
from the normal
yes.
breast that they have known since they started developing the breast,
Yes.
they should immediately.
Seek medical advice.
Okay.
Medical advice.
Now, about breast cancer.
Yes.
It's a hot topic. It affects many women. I think it's the number one leading cause of death in women.
It stands at 11.6% among the cancers.
Among the cancers.
Yes.
The cause of death.
The cause of death, yes.
Is it preventable?
It is very preventable. Breast cancer is very preventable depending on
The risk factor?
The risk factor, how you can avoid the risk factors, and how soon you can, or rather how serious you can take your medical advice. Preventable in terms of probably if you rather take the risk factor serious, the one that I've named, probably avoiding alcohol, avoid exposure to radiation.
Now you're talking about the modifiable ones.
Yes, the one that I can change.
Okay.
These are things like exercise. These are things like we can reduce our weight. We can get babies. Not having a child is actually a risk factor of predisposing to breast cancer. Breastfeeding. Breastfeed as required. Avoid using contraceptive pills. Avoid using hormonal therapies. Alcohol is reduced. And even exercise. So exercise a bit. If you come from work, put your bag, pack, take your gym suit, go and do an exercise.
Some little jogging.
Yes, jogging and also have your wellness clinic. Take them serious, because those are things that can be detected early and prevent this from being a tragedy.
Wow.
Yeah.
Thank you, Mike, for that. Now, to that viewer outside there,
Yes.
maybe as you are talking, he discovers or she discovers has some of these signs.
Yes.
It definitely doesn't mean that they have cancer.
No.
So about the diagnosis, how do you arrive to a clinician now in the hospital setup? How do you arrive to a point whereby now you say, now this client X has cancer of the breast? The diagnosis part.
Thank you, Ben. Before I respond to a question, there are a few conditions that you can confuse with breast cancer.
Okay.
There's something called fibrocytic diseases. These are basically some of the lumps in the brain, in the breast, that are not really cancerous, but they're just lumps. There are fibroadenomas. These are also lumps in the young ladies. They appear between 20 to 30 years. These are young ladies' lumps. Those are not even also breast cancer. There's a breast cyst. It's just a fluid sac in your breast. So before you get either worried or rather start questioning about your state, or rather, it's just good to go and get examined. And this is when it's very important to go and be diagnosed. And now we reach to your question is, how do you diagnose breast cancer? From the clinical perspective, we start from history taking. We find about yourself. How do you know about yourself? What has brought you here? You'll tell me probably I've been seeing the dimpling in your breast. There's some discharge in your breast. There's a lump I've palpated last night when I was showering. Those are things it guide me when you're giving me your history. Then myself, I'll do what we call a physical exam. I'll inspect. By inspection, I'll be able to see the discharge. You're able to see the dimpling in your breast. I'll also be able to palpate your breast and feel the lump in your breast. From there, we'll do what we call screening. We can do a mammograph, which is, I'll advise most ladies to go for it. I'll do an ultrasound for the same, and even do an MRI of the breast. And then with that, we also do a blood test to coincide with the screening. These are tumor markers of the breast. That doesn't mean when the tumor marker is elevated, probably you have a breast cancer. No, but you have a confirmatory test. After all these have been done and directed us to probably something that's not right, we'll do what we call a biopsy, which is the golden test. So with biopsy, there are like several ways we do biopsy. You can do a fine needle biopsy. We just spread the cells on the slides. Then we take the laboratory and we look at it. There's also a core biopsy. We remove a small part of the lump. Then we take it to a laboratory and examine. There's surgical perspective of the biopsy. Rather after the surgery, we can come up with the whole breast and take it to the lab for histology and examine it. And then from there, we'll have now the diagnosis of what we are dealing with through all those investigations. So there are a number of investigations that we carry for us to come up with this diagnosis that we have a breast cancer, or rather we have a benign breast cancer, which is not cancerous. So depending on what we get, the report we get from the laboratory.
Wow.
Yeah.
So in short, from what I'm getting you, it's normally a journey.
It's
It's not just a one-day stop thing. So this client comes to your facility, then immediately comes out, no, it's cancer.
No.
No. So it's
No.
a journey. You have to carry out several investigations.
Several investigations before you come up with a diagnosis this is cancerous.
So you talked about also genetic. I remember you mentioned about genetic.
Yes.
So in your history, do you also take history about history of cancer in the family? Are there those cancers which normally run down the family line?
Actually, most of the cancers, we tend to ask questions, is there any person in your family who had this cancer? Because we tend to assume that it's genetic, it flows in the family line. So genetic, we have to ask, is one of the...
Is it just any member of the
basic
family, or it cuts across? Is it that is a very close relative, or, for example, if maybe I had a distant cousin who had cancer, or does it narrow into?
No, normally we have first, second, and third degree family.
First, second, and third degree.
Yes, first family probably can be a family, close member. Second family can be your parents and your uncles, your brothers, your aunties. Then third degree can be your great-grandfathers, great-grandmothers. So we have to ask, do you have any history of cancer in the family? Is
And
there
in
any
this case,
person
we
who has
emphasize
suffered?
on the first degree.
The first degree, yes.
Okay.
Then probably they'll tell you, oh yeah, my young brother had this, or my elder brother had this, my father had this, and from there you can now start relating. And so for you, it actually guides you to run more tests, because probably there's a link in the family that somebody has suffered the cancer.
Okay.
So family history is very important, very, very vital when you're doing history taking, when you're diagnosing the patient, because you also get to know, are we dealing with a naive case, or probably is something that has been there in the family? Yes.
Thank you, Mike, for that clarification. Now, after you have diagnosed,
Yes.
you said you do a biopsy. That's the confirmatory test that somebody has cancer of whichever cancer, maybe in this case, cancer of the breast.
True.
Confirmatory test is a biopsy.
Yes.
Now, after you have diagnosed this viewer, is that the end? Or do we have, let's do like this. Just hold it a little bit. We'll take a break. Then we'll talk about, is it the end of the road after the diagnosis? Because most people say they have that stigma of cancer, and they believe these are death sentence. Diagnosed with cancer, period.
Done.
That's done.
Yeah.
So is there hope outside there?
There's hope.
Viewer, stay there. We'll take a break, and we'll talk more about the treatment about cancer, how to prevent, how to do examination. With my guest here, Mike, he's going to take us through it, the journey. Don't touch that dial. Today we have an interesting topic, cancer of the breast. With me in studio, I'm still here with Mike, a clinical oncologist. He's talking to us about cancer of the breast. And you talked about so many things, from the signs and symptoms, how it presents, the diagnosis. We're talking about treatment. Welcome back, Mike.
Thank you.
Now, we are talking about radiotherapy.
Yes.
You said about we have even spoken about the side effects of radiotherapy.
Yes.
You mentioned hormonal.
Yes.
What is this animal called hormonal? I want my viewer to understand this hormonal treatment. This word sounds Greek. This hormonal treatment, is it? It looks like something from the moon.
Yeah, hormonal treatment, these are treatment basically that hinders cancer cell. You know, cancer cells feed mostly on these hormones. So what hormonal therapy is, they hinder this, they prevent these hormones from reaching the cancer cells and feeding them. So they starve them and eventually causing them to die. So depending on during the biopsy report, what report did you get? Do you get estrogen positive, progesterone positive, HER2 negative? It's not a treatment for everyone. There are tests that your oncologist will run.
So there are different tests.
There are different tests that oncologists will run for you to
I thought you just take a biopsy, take the lab, cancer.
No.
Treatment.
For hormonal therapy, there's specific tests that your oncologist will run for you to be a candidate of a hormonal treatment.
Okay.
So it's not for everyone.
Not all of them are put on hormonal treatment.
No.
Okay.
So these tests are the one that probably your oncologist will ask for.
Because I'm trying to imagine that viewer, imagining I had that hormonal treatment. It looks more friendly.
Let me run the...
I just go to a oncologist and say, I want this hormonal.
No. If your oncologist has not given you that hormonal, probably your test did not turn positive.
Okay.
Because it has to have some hormones that are positive for you to be given that one. For probably HER2 positive, these are you get treatment called trastuzumab. For estrogen and progesterone positive, you get a treatment called tamoxifen. So it depends. If the test was positive for you, you'll qualify for the treatment. If you're not positive, then we'll advise you another modality of treatment.
Now, this hormonal treatment, how long does it run? Is it also just a one-day thing? I take the drugs only once, then I forget? Or is there a duration?
It's also a scheduled treatment.
Okay.
It's also a scheduled treatment that also run after a few weeks that you advise to your oncologist. Because the others you can go up to 18 cycles of the same treatment, like Herceptin. The others you can go up to 12 cycles. So it is a scheduled treatment. Yeah, it's not a one-day thing.
Oh, okay.
Yes.
So this hormonal treatment, once somebody has been diagnosed and the receptors, you talked about the positive, they can be on them for how long? Basically, the minimum.
The minimum that you can get.
Yeah. They can be put on so that I'm prepared psychologically. I know at the end of the day, this hormonal treatment, I'm going to start on it, and I'm going to be taking this treatment for maybe a month, 2 months, 3 months. I know I'm done with it. Or maybe like 1 year. I know because that's the standard. 1 year, I'm done with this treatment here.
That one also depends with your oncologist who is planning your treatment, because he knows better how your tumor is, how the stages you are. But the minimum we can also go probably is 6 months to 1 year.
1 year.
Yes.
Okay.
So that one depends on who is taking care of you.
Okay.
Yes.
Back to the common question. Are there side effects for this hormonal treatment?
Yes, the side effects. The
Which
side
are some of
effect
the
for
side
this
effects that my viewer outside there can be able to know? Or maybe they're taking the hormonal treatment. So then maybe they are feeling. Which are some of the side effects?
Yes, the side effect for this hormonal treatment, and one of the probably worst side effects that can also predispose you to endometrial
Endometrial
cancer.
Okay.
That's one of the unlucky side effects. And then there's also this sweating, that night sweat you can get with this menopausal, with this hormonal treatment. Weight gain can also be one of the side effects of this hormonal treatment. And things like probably nausea as well. You can also
Even
get
nausea.
from this hormonal treatment, yes.
Okay.
Yeah.
But they're all manageable.
They are manageable. Yes, they are manageable. And then with those serial visit to your oncologist, you can also detect something that's abnormal.
Because I'm trying to imagine somebody might develop this. You talked about sweating, or is it premenopausal?
Yes.
Then all of a sudden, I'm young. Then all of a sudden, this girl is just in premenopause.
All of a sudden.
So chances are very high might discontinue the treatment.
Chances are very high you might discontinue treatment, but now that's when we come in. The good thing with cancer management is not a one-person show. It's a multidisciplinary treatment. There are those who are dealing with pain palliative treatment. There are those who are dealing with counseling, trying to put you in order. And then there are us who are dealing with medicine. So it's a multidisciplinary team management, yes.
Wow. I believe today we have learned a lot. Now, this patient, is that the end of the road? After they have gone through the surgery, chemotherapy, you've talked about radiotherapy, then hormonal. Is that the end of the road? Or what normally happens now to them after they are done with these treatment forms that you have talked about?
What is done with now, what is remaining with us is just the patient remains my visitor now. We'll keep on now doing what you call consultation visits.
Okay.
I keep giving a patient probably after 6 weeks, come see me. After 3 months, come see me. After 6 months, come see me. After a year,
So
come
in
see
short,
me.
what you are telling them is they should not discontinue going to see their clinician.
No.
That's not the end of the road.
Until I tell you, like now, you can see me after 10 years, or rather. But yeah, we'll have serial visit, consultation visit. I come back, I examine how you're doing, how you're feeling. Is there anything that's happening? Is there anything that I need to know? Probably, have you noticed anything? And then in between, probably I can also do a scan, a PET scan, just to see was there anything that developed after you're done with treatment. So that's not the end of treatment, because I have to have a serial visit before I declare you cancer-free.
Okay.
Yeah.
You're talking about cancer, the diagnosis, the clinical features. You have talked about the treatment, now the follow-up. I'm trying to imagine this client outside there. Is there a way we can detect it at a very early stage so that we can manage it? We don't reach to this level whereby you now start the treatment, the surgeries. Are there ways you can maybe advise in a nutshell, just a little bit, what they're supposed to be doing, the ladies out there, even the men? Are there things they're supposed to be doing so that we can detect it at a very early stage?
There are ways we can do to prevent this. The things that we advise most of our sisters, our cousins, our aunties is that like a week after your menstrual period, what you can do is to try and do a self-examination and see and detect any abnormal discharge on yourself. Also, you can.
So it's a week after the menstrual
period. Yes. Okay. Don't do it during your menstrual period. Of course, there's some changes that appears in your breast during your menstrual period. So you can do a week after your menstrual period, and then you examine yourself. From there, you can detect any changes. Then you can look for clinical breast examination. Now you can come to us for further examinations. You can also have your like I started by saying, you can be a friend to a hospital. Do your wellness clinic. At least after every 3 months or 6 months, go for a wellness clinic, get checked. Yes, which is also available in our country right now. The prognosis of breast cancer depends actually with the stage.
The stage 1.
Yes, if you get it at stage 0, it's 100% cure.
Okay.
Stage 1 is 100% cure.
No, okay.
When you get at stage 2A is 92, around 92%. If you get at stage 2B is around 81%. If you get at stage 3A is around 67%. If you get at stage 3B is around 54%. If you get at stage 4 it's 20%. So you can imagine, if you got it early, you can actually...
Almost 100%.
You
are sure of you can cure it.
Yeah.
And it's here in the country.
So prevention is better.
Prevention.
Yes. Yeah.
I'm trying to imagine the breast self-examination. I believe it takes a demonstration.
Yes.
Because I believe I've met several people, they tell you, I normally do it.
Yeah.
I do it daily. I do my breast self-examination daily. You talked about 7 days after menstrual period.
Yes.
That's the advisable
Yes.
time to do the
Yes.
breast self-examination. Is there a way they can follow the breast examination? Is there a laid down modality where they can follow maybe a sequence? Let me talk about the sequence. Or they just do it any place, they are standing, they just feel their breast?
No. Most people right now in our country, we are a bit lucky. The internets are all over. We can actually Google and find out how you can go about this self-examination. But the most advisable is that you go after work, go to your bathroom, undress yourself, look in the mirror. You can hold your hand back of your head, then just go around your breast and examine and find out anything that's abnormal.
Okay.
Round, yes.
Oh. Wow. I think we can continue talking about this thing till tomorrow.
Yes.
Or till till the cows come back home. There's a lot and it's getting more and more interesting.
Yes.
Now, because of time, what is your parting shot? And how can my viewer reach you so that maybe you can even educate them more on breast self-examination? Both male and, because you said both male and female, they also get breast cancer. So how can they reach you so that you can give them more, empower them more on this issue of breast so that we detect it at that 0 so that it can be 100% curable? How can they reach you and your parting shot?
My parting shot for breast cancer is that breast cancer is curable. Let's try as much as possible to prevent it. And if possible, let's find it at an early stage. And for my fellow men, this thing is not only for female, it's also affect us. 1% can be you. So also don't take it for granted. You can also do a self-exam on yourself and detect it early. How you can reach me? You can reach me at my Twitter handle is Odunga Official. And then and my Facebook is Mike Sam. And then my numbers are 0713 57 56 66. 0713 57 56 66. Thank you.
Thank you, Mike.
Pleasure.
There you go, viewer. You've heard it from our guest, and I believe he has been so enlightening on cancer of the breast. So I don't know what's holding you, maybe or preventing you from going out there and be going for that examination so that we can detect it at very early stage. And as he said, there's no need to fear because there are treatment modalities which are available in the country, and they are right here in the country with us. I started by quoting Mae West. We only live once. And if we live right, even that once is enough. It's enough by just you doing the simple medical examination that my guest has shared with us, breast self-examination, the clinical, going to your oncologist and getting some opinion about breast cancer. If you have the clinical features that he has talked about, let us avoid the late stage, of which he talked about. The chances of survival are very minimal towards the end stage. Let us watch our health, because our health is wealth. I've been your host, Ben Bella Onyino. Till next time, bye.